welcome to today's interview, everyone. We're going to be talking to Professor Amy Brown, a Professor of Maternal and Child Public Health at Swansea University. Hello, Amy. Thank you for joining me today. So what's your background and what's the ultimate point of your research area?
Oh gosh, so by background, I have a degree in psychology and a PhD in psychology, but I've always been really interested in early parenting and how parents make decisions around caring for their baby and how they get that information, who they get it from, and how ultimately we can better support them. So I've always been interested in parenting and nutrition, but it was having my own baby, who is now nearly 17, which really got me interested in the area, because I just realised that there was so much misinformation out there and so much anxiety and worry about caring for babies and feeding them. So I thought I'd start researching, how we can better support parents with this. And well, 17 years later, still going, still a lot to do.
That's amazing work. So how did your research then lead you to setting up the LIFT Centre? So that's lactation, infant feeding and translation?
Yes. So as I said, about 17 years ago now-ish, I started researching this area, and we just built more and more and more research around how we can better support parents through those early years, and also the professionals who were supporting them. And it just naturally led to the suggestion that we should set up a research centre around this, because we had so much information and so much research, and we've always had a real emphasis on public engagement, or in other words, actually doing research that matters to the public and the people who need it, and trying to convey that in a really usable, relevant, easy to understand format. So we had so many articles and blogs and videos and all sorts of things that we wanted to collate that all into a public resource, but also just showcase the research we were doing around that, so it would be something really recognizable and something that people could trust and come to for their information.
I mean, that's a very important part, the trusting factor, isn't it? Because people just want that personal one-on-one and talking to a human as well, isn't it? It's humanizing the experience.
Yeah, I think you get a lot of research that is brilliantly done, but not necessarily very accessible. So you have this great research study, but what does it actually mean to a mum who's up at 3 a.m. feeding her baby and worrying about all these things? And that's what we do with the centre and our research. We do a lot of research around almost the obvious questions, but things that haven't got research evidence behind them. But sometimes doing a piece of really obvious research is actually really useful, because it gives you that evidence, it gives you that study. So in the past, we did a piece of research that quite simply showed that babies wake up at night. Who'd have thought babies wake up at night? But actually what it was doing was reassuring parents that it was absolutely normal, because it just helped to show that, oh, okay, so my baby is waking up 2 or 3 times a night. Oh, actually, that's normal. And everything people around me are telling me, like put my baby in a routine, or don't respond to them at night, or stop breastfeeding them, we're actually able to show, well, actually, from a research perspective, there's no evidence that those things will actually make any difference. So just carry on parenting the way that you want to parent.
That's really extensive research and really valuable research, because I think a lot of people just think they have to do things in certain ways, don't they? And what role do you think the RWIF funding helped with this specifically?
Oh, it's just given us a huge boost. So we set LIFT up. It's all a bit of a blur now, especially with COVID. I can never remember what year we're in. So I think it was 2019 we set up LIFT, but it might have been 2018. I don't know. Pre-COVID, we set up LIFT, the before times. And it was great. We had all our connections with organisations outside of the university, and we had PhD students, and we had staff working around the centre. But what the funding did was allow us to really invest in the centre by, first of all, we employed a senior research officer. So we employed Dr. Amy Grant, and her role was to look for more funding, to help with paper writing, to do some public engagement. And that investment, it just paid off so many times, in that as soon as you have somebody who's got the time, the protected time to do that, and somebody, you know, who has the skills and the knowledge around that, we just suddenly started getting in more and more grants, which employed more and more people, and we wrote more and more research, and we did more and more and more, and we've just grown and grown. So I think we had a really small sort of funding target that we were going to bring in, that was, you know, more than it was going to cost to employ the researcher, and we just, I think we beat that by about 10 times or something. So a huge part of that was Amy had the protected time to write a mid-career research fellow application to Wellcome, and she got it. So it's a £2.4 million project that employs a further 4 research assistants on it, and it's for 8 years. Yeah, autistic experiences of reproductive health and pregnancy and menopause and things like that. And so it's just grown and grown and grown. And if we hadn't had that investment at the beginning, we wouldn't have been able to do all these different projects. And the more projects we did, the more money we got and the more kind of impact we had. And it just shows what investment can do.
Yeah.
Not only for bringing in money, but for developing people and creating new opportunities. And over the project, on all our different funded projects, we must have employed 10, 12 different people over the course of it, and had students working on projects and newly graduated students who wanted a bit of experience, you know, 1 day a week doing an honorary role, and it's just enabled so much.
That's brilliant. And a lot of people we worked with haven't just been internal, but you've worked with loads of external organisations as well, haven't you? So who have you worked with there?
It's more of a case of
who
we worked with. We often kind of tell the story of kind of certain events, and people kind of look at me as if to say, "You're right," because that sounds all a bit odd. It's given me protected time as well, and a bit more time to go off to different conferences around the world. So we've worked with different public health organisations, infant feeding charities, parenting charities. We had a slightly strange experience at one point going to Downing Street for a St David's Day celebration with Boris Johnson. So it's all completely surreal when you start looking at it. We've presented to all party parliamentary groups in Westminster. We've been there a few times, in online health forums, just so many different opportunities to take our research and make a difference to people, because for me, that's why I do what I do. Yes, of course, doing good science is really important, and being, you know, a scientist is really important. But the biggest draw for me has always been, can I do some research that will make a difference to a parent who has postnatal depression, or a health professional who is thinking, well, what is the evidence, the new evidence around this since I last trained? And being able to go out and talk to parenting groups or infant feeding organisations. And I spend, as you know, quite a lot of time on social media, really trying to distill the work that we do into messages that a sleep-deprived parent at 3 a.m. can scroll through their phone and go, oh, all right, yes, okay, I understand that. And yeah, I just love what we do. So.
That's brilliant. Yeah, I've taken a look at your social media pages, and that's so brilliant. And I love how you can reach a completely different community that probably don't realise they want to look for this information, or probably don't realise they need to find this information, but they follow you and engage with you, and then actually get valuable content then that's, you know, helping them go through the progress, which is just brilliant. So
I was looking the other day, a few years ago, we made some animations around normal baby sleep and baby routines and things like that, just trying to distill the information into about a 3-minute clip. and I can put them onto my Facebook page. And I was looking the other day and they had something like 7 million views each. And I was like, oh, okay, quite a few people have seen those then. So, all right. But yeah.
Amazing. Your work and your research is impacting so many different people from so many different backgrounds, and that's just brilliant to be able to influence. So that must feel amazing, you know, that must feel really great.
Yeah.
So I'm really interested to know what sort of questions are asked by parents and what kind of areas of your research, you know, really help give answers, and why is it so important to new parents to find this information out?
Yeah, I think we've done research in so many different areas of
Mm,
feeding babies and caring for babies now, but I started off with my PhD
mm,
looking at the impact of the advice you get about how to care for your baby. So when you have a new baby, absolutely everybody has got an opinion on how you should be looking after them.
yeah.
You kind of get the sort of official guidance of, this is, what babies are like, this is how you feed them. But absolutely everybody out there has got a view on what you should do with them. And there are so many extremely well-selling books
Mm,
that give guidance that is not often realistic or isn't really particularly evidence-based, but they're really powerful because they've sold 10 million copies and everybody's telling you to go and get a copy, or someone in your family is telling you, particularly if maybe they're older and the advice was different back then, that you should be doing this and you should, not be responding to your baby at night, or you should be feeding them in a routine.
yeah.
And we know that that's not how babies work, as adults.
Yeah.
Like you, but I've got a drink here. I don't feed or drink every 4 hours on the dot. Why would a baby be any different? I don't sleep through the night. Don't sleep for 8 hours solidly every night, but
Yeah, of
if I
course.
wake up, I can get myself back to sleep again. Sometimes, most of the time. But for some reason, there's a lot of information that's what babies should
Yeah.
sleep at night. You should put your babies in a routine. And what our research has done is really kind of look at the different concerns parents have and then
Mhm.
try and answer them in research. So we've done research that looked at the impact of feeding your baby in a routine or not.
Yeah.
And we looked at the impact of, well, does how you feed your baby affect their sleep or their behaviour?
Yeah.
And long story short, we've always kind of found that if babies are babies, they wake up at night, they feed
Yeah.
frequently for all sorts of reasons. And if you try and interfere too much with that, it often doesn't work.
Of
And it
course. Yeah.
often leaves you feeling really frustrated and upset. So
Yeah.
we do a lot of work around mental health and well-being around that,
Yeah.
because I think, we know a lot of parents struggle with their
Yeah.
mental health after having a baby. So these books and these social media influencers who tell you that they can get your baby to sleep all night, we've shown with our research that actually can make you feel really frustrated and like even worse, because you try and implement their advice and it doesn't work, so you end
Yeah.
up feeling even more rubbish. So it's just kind of reassuring parents that their baby's normal. And, on some levels you think, well, that's not very groundbreaking, but actually it is, because
That's
it makes such a difference to that parent. So
definitely, and that's so important. And that goes, you know, brings us on to parents can choose to feed their babies different ways, and they can go into formula quicker and slower than other parents. You don't have to compare. And you've got a lot of research supporting parents who are formula feeding their baby and how to support this. Can you tell us a bit more about that?
yeah, so a lot of my research over the years has looked at how challenging different feeding experiences can
Mm.
be, and that I work with quite a lot of mothers who really wanted to be able to breastfeed, but they faced huge challenges around them, usually challenges with going back to work and not getting enough support, and getting incorrect advice from people, which has really harmed their breastfeeding experience. So we've always got some parents who make the informed decision that they want to formula feed their baby, and that's great.
Yeah.
But you have a lot of parents who really wanted to breastfeed and are really distressed by not being able to do so
Yeah.
because of the society that we live in just really isn't very supportive of breastfeeding. And they need to move on to formula feeding, and they feel really distressed about that and really blaming themselves a lot of the time when it really isn't their fault. But when they then move on to using formula, they often find that they're just struggling to get the information that they need. And we have a major issue in the UK and, well, globally, that the companies that are making formula products have been shown to often use really underhand tactics to try and promote certain products and make promises that their product will support your baby's health in a particular way, or they'll support your baby's behaviour in a particular way, that could make your baby sleep, or everything that, you know, really exhausted parents want to hear. Or when parents are really struggling with not being able to breastfeed, they, you know, they're looking, which is the best formula for my baby, and this company is saying, well, this formula has got all these added ingredients in. But we know that there's no evidence to show that those additional ingredients are making any impact to infant health. And it's a problem because those formulas are priced at a really expensive price point, far more than they actually cost. So we've done research over the years really trying to understand parents' concerns around that. So what they are seeing in terms of advertising and what they are being told around different formula milks, and just really trying to reassure them that in the UK, all formula products for your baby are nutritionally complete, the ones aimed at babies for 0 to 12 months. And if you select one of those, your baby will be well supported. There is absolutely no need to go and buy the really expensive one and spend more money than you've got, or worry about not being able to afford it, because that's what we saw in our research, that we naturally assume, don't we, when we go to the supermarket, if you see a tin of formula for £7 and you see one for £18, you think, and it's got all these slogans and advertising and looks really scientific, you think, right, the £18 one must be the best one. You know, we do that with baked beans, you know, we assume that. So we do it with everything. And we found that parents were choosing that one because all this, you know, the information around it really told them that this one was better for their baby. So that's underhand, full stop. But then parents were spending money that they couldn't really afford on it and going without themselves, or they were feeling so guilty that they couldn't afford it. And we just wanted to get the message out that buy the £7 one, you know, buy the one that, you know, it's the same, essentially, virtually the same, or at least that there's no evidence that there's any impact that one is better for you than the other one. So it's that, it's about getting those messages out there around, you know, just buy the formula that, you know, that suits your price bracket, and don't worry about it. Don't feel guilty that you haven't got the best one, because there is no best one. So.
Exactly. And for people who don't know anything about this, they can be assured that, you know, your work adheres to the World Health Organization Internal Code of Marketing for breast milk substitutes, isn't it? So it's a bit of a mouthful. I tried to remember that.
We call it the WHO code. It's a lot quicker.
I know. So, you know, people don't need to be drawn in by this fancy, long, complicated marketing that just is the same as something else. And I think because of social media, people are constantly looking at other mothers perfectly, you know, displaying their products or breastfeeding. And not everyone's going to be like that. And how realistic is that anyway, what you see on social media?
That's basically what we try and do. We try and do the research that shows you the evidence and the facts that you need to then go and make your own decisions. So we're never saying don't go and buy that particular formula. If you do, if you want to, that's fine. But don't feel guilty that you can't afford it.
Exactly. And it's so important that people like you are, you know, putting themselves forward and doing research like this. And why is this research so important to you? What's your drive? What's your motivation for this area?
I just want the research that we do to help at least a little bit to support more parents in terms of their well-being, because we know how difficult that whole experience around pregnancy, birth, and those early years it's really difficult. There are so many voices telling you to do this or that, or that you need to do things differently, or making you feel like you're failing. And
Yeah.
you just want to do the research that helps. So it helps you care for your baby in the way that you want to care for them, so that you've got the information that you need and you can feel that you're able to care for your baby in the way that you want to, and to support your mental health in that way.
Amazing. And with your research, what do you think of the benefits have been from working with the public and, working with organisations surrounding this topic?
I mean, it's made such a difference. There's no way we would ever do this research without parents and without those organisations. So it's a continual exchange of information, really. Parents are telling us what they're worried about. I mean, my children are teenagers now. Time moves on.
Yeah.
I don't know what parents are currently worried about. I'm not in that little parenting bubble anymore. It was very useful when I was doing my PhD because I was surrounded by it all the time. But
Yeah.
parents tell us what they're worried about, and we can take that information and do the research that helps support their questions. And then we pass those findings back to them. And we can pass it to organisations that are working in infant feeding, who can then use that to support training in their organisations, who then go back and support the parents. So it's a continual cycle of just trying to make things a little bit easier for everybody. And I can't imagine not. It's just be really, really alien. I don't think there's a day that goes by when I don't talk to a parent or somebody from an organisation that we're working with, because it's just so intertwined. I just can't imagine anything different, really.
Oh, that's brilliant. And so your work has been, recognised by so many people and so many different publications and different media. To name a few, the Economic and Social Research Council referenced your work. I know that Made at Uni Lifesaver Awards recognised your work as well. These are amazing milestones to have achieved. Congratulations. And how important do you think then it is for external organisations to share your research, to engage with this research and share it to their communities as well? Because it brings more people to this research area, surely.
It does. I mean, I think firstly, it's amazing that those organisations recognise this type of research, because it feels that going back 10 or 20 years, they might not have, but I think they're really changing to, and I think the whole research world is changing to see the value of research where you engage with the people that it's meant to help.
Yeah.
And, we don't do the biggest funded projects. Our projects aren't bringing in millions of pounds to test something. We're doing smaller projects, but we're really showing the value of that. We're showing the value of the engagement, and that matters too.
Yeah.
So yes, of course, great, big funded projects are amazing, but also being able to work with an organisation and have impact and see your work actually making a change out there. I mean, our papers, they're smaller studies, but they've really made a difference. They underpin a lot of different policy documents, particularly around infant feeding and mental health.
Yeah.
As I said earlier, I've presented my work to Parliament a few times. I was invited to go and talk to the government in Australia, and then based on that, the government in New Zealand, because they obviously wanted it to. It just really shows that this type of research and public engagement and dissemination and working with communities actually is really, really valuable. And I think that's the biggest message to any early career researcher listening to this.
Yeah.
I'd say, get to know the people that your research matters to.
Yes.
It's just really important. You are there to be able to support the challenges that they face.
Yeah.
So it's listening to communities and seeing what their questions and their challenges are, and thinking, well, how can we design research with those communities that will benefit those communities? And how can I work with the different organisations that are already out there working on the ground, supporting people to make sure that what I'm doing is accessible and understandable, and actually useful, and it's the most lovely feeling. I mean, I'm sure very much if you did your big project with your huge grant, then that's going to be lovely as well, brilliant. But also to me, maybe I should say this, it's also always far more important when I know that there's a mum at home whose mental health has been changed. And to me, those little messages I get emails quite often, saying, I read one of your books about your research, and it just completely changed how I felt about my experience of feeding my baby. And I'm like, yeah, that's why we do.
That's what matters. Yeah, 100%. The personal aspect, that goes a lot further than a publication maybe referencing your work. It's when you hear it from the actual person. Yeah, 100%.
Academia is getting a lot better at recognizing that. We're putting a lot more impact, of emphasis now on impact on public engagement and really working with communities. And I think it's a brilliant thing.
Definitely. I mean, it's just one example of how the RWIF funding has helped to reach, the external partners, the external people, and help reach the wider community who don't even know where this research or help has come from. They don't know it's RWIF funded project, and that it's just goes to show how great this funding can be towards people.
I'd say it's been completely life-changing in terms of, the people's lives we have managed to change because of it. It's those stories that are really, really important, alongside your metrics and, we got this funding and that funding, but actually, mum who's sitting out there and now she's, got the support that she needs.
Exactly. And what would be your advice to other researchers who are, thinking about widening their public engagement, for example, and developing their skills in this area?
I'd say reach out to the communities that your work affects. Social media can be really good for reaching those communities. Think about what your research means for people or the communities that it affects, and really thinking about how do you distill those messages in a way that everybody can sort of really get their teeth into and understand the impact of, and keep sharing your findings, write blogs, write for the conversation, always, talk to the media office about papers you've got coming out. It's just about not being scared to make that step to start talking about what you're doing and to get it out to the people that matters as well. And yeah, absolutely, that paper you've just published is brilliant from a academic perspective, but who can you get it out to? What could you write about it in a way that people will read? Because your average person out there is not going to sit down and read your entire research paper, but if it's in a blog, if it's in a social media post, then you could really make a difference to someone's life out there with your findings. So get on with it, go and talk to people, go and introduce yourself to organizations that are doing work in your area, and just don't be scared to go and do it.
Definitely. And I've gone on your profiles and your social media, and I just do admire how you built up this community surrounding your research. And you've got people engaging, you've got people interacting, and I feel like it's sort of a safe place for parents and people to go to find research, and that's so important. A safe environment that they don't feel judged, they don't feel like any questions are going to be silly, and that's what you've provided to parents. So that is really truly great work.
Alongside a lot of posts about running shoes.
And that.
Evidence-based parenting information and whatever trainers I've just bought.
But again, humanizing the interaction. And I think a lot of parents might think, well, she's not, not telling me what to do as such. It's not like this is right, this is that. You're offering advice and help and support and ongoing. It's not just 1 week you're interested in this. This is your whole research area. It's ongoing constantly. And I think that brings a lot of reassurance to new parents. So congratulations for that, because it's really important. But I really want to discuss as well the donor human milk hub that the RWIF project has helped complete and stuff in Wales for the first time. I mean, I think that's just tremendous work. And what led to this idea, and why do you think bringing this donor into Wales for the first time is so important?
Oh, right. Okay, that's a long story in itself. Got a few questions in one go. So we know that when babies are born prematurely, so when they're born early, particularly when they're really premature and really very small or unwell, being able to receive human milk is really, really important for their development. It can shorten how long they're in neonatal care. It can help prevent against really deadly infections that very premature babies are really susceptible to. So we know that human milk is really important, but we also know that when a baby is born prematurely, it can be really challenging for mums to start building their own milk supply. Obviously, they've got the whole stress of what was probably a shock at their baby being born early. They're getting to grips with everything, and they've got to start expressing milk for their baby because their baby will be too small and weak to feed at that point directly. So this is where donor milk from other mothers come in. So mothers who have an older baby now can express and then donate the excess milk that they've got, and it's treated to make sure that it's safe for very small, vulnerable babies. And then it can be used with those babies whose mother is building their own supply, or who is unable to or doesn't want to breastfeed directly for whatever reason. So babies in neonatal units across the UK have access to this donor milk when they're born at a certain age. And in Wales, we historically have not had a established donor milk bank for that supplies milk for babies within Wales. There was, going back, gosh, it must have been, from what parents now tell me, about 40 years ago, something around in Cardiff that enabled donor milk to be shared within Wales, but there hasn't been something for a very long time. So I've been fighting for some sort of donor milk service from within Wales for a very long time now, because babies in Wales do have donor milk, but it's brought in from England. So in the north of Wales, that's served really, really well by Chester, because it's really close, obviously, geographically across North Wales. But in South and West Wales, it would need to be brought in from quite a long way away. So it was often Birmingham or sometimes Chester down to the bottom there. So from a environmental perspective, from a logistical perspective, what we really wanted was something within Wales. And, you know, from a Welsh perspective, I'm Welsh, we want our, you know, something within Wales, don't we? That's us. So the funding allowed us to cost in, working with one of our key partners, the Human Milk Foundation, to establish a hub. And what a hub is it's based in Singleton Hospital in Swansea. So it's essentially freezers, but what it does is it allows larger amounts of processed donor milk to be stored, and it also allows us to collect donated milk from women locally. So historically, at least for the last 10-20 years in Wales, women who live in southwest and mid Wales haven't really been able to donate their milk because of the logistics of getting it to a milk bank. So obviously it needs to be transported safely. It needs to be frozen, and it needs to reach a milk bank with a certain amount of time. So it's not exactly like you could post it to a milk bank once you expressed that you needed to be able to get it there safely. So what the hub has enabled is women in our local area here to be able to donate for the first time. And that's a huge thing, because not only does it increase equity in who can donate milk, it increases the amount of milk in the system that can be used to support more babies. But our research around this really shows the value for women's mental health who are able to do it, because the value of being able to express and donate your milk to help support other babies is huge for all sorts of reasons. So I think that was the long story short around what it has done. I mean, I could literally talk about this all day, and you can't stop me talking usually, because I've talked all about, you know, what the RWIF funding means for setting up the Centre for Lactation, Infant Feeding and Translation, but what it's done for changing services and changing lives within the South West Wales in terms of this milk bank hub is huge. It's made such a difference to the hospital. It's made such a difference to the community. Made service delivery of bringing in milk much smoother and easier for hospitals in this local area. But it's the way it's changed the lives of the donors in the area. We did some research with them that asked them, you know, we looked at experiences of being able to donate milk or not. So that enabled us to look at the women who wanted to donate milk but couldn't before it was set up. And then the impact on those mothers who now can donate milk. And you know, it just makes such a difference. And the connections we've made with different organizations. And
do you mind naming a few of those? Who have you worked with on this project?
So our main partners are the Human Milk Foundation, who are in Hertfordshire.
Amazing.
So they are the milk bank, so they process all the milk for us. So we collect the milk in, and when we have basically a car boot full in our milk bags, we take it to be processed and we come back with more milk to stock the freezers. But when we set up the partnership, we worked really closely with Swansea University Health Board, because the hub is based in one of their rooms in Singleton Hospitals. So we've got that connection there with the neonatal unit. So now when babies on the neonatal unit need donor milk, rather than having to contact a milk bank in England, they're just able to pop downstairs and get it from the freezer. So obviously logistically that makes a huge difference to them. And then other local hospitals who have units can sometimes order from us. So, and the other organisation that we work really closely with is Blood Bikes Wales. So I don't know if you've heard of Blood Bikes, but they're a charity organisation who transport medical products for the NHS. So if you see them out and about, you'll see it usually says Blood Bikes on the back. So bright yellow bikes, usually wearing a bright yellow jacket, you can't miss them. So one of their main jobs is transporting blood. Transporting tests, but they also transport the donor milk. So they go out to mothers' houses and they pick up the donor milk and they bring it into the hub. And quite often they sometimes take milk for us to be processed by the Human Milk Foundation. And it's just lovely. It's just such a different group of people to work with.
How exciting was that to achieve, to be able to work with the variety of people you've worked with?
It's the world's loveliest project. It's just, I can't get over how lovely it is and how lucky we are to be able to do this. So yes, the project has made a huge impact on kind of healthcare supply of bringing donor milk in, so from a logistical perspective. And it's made a huge difference to the neonatal units and all of that. And it's made a huge difference to families and communities in the area. But it's also made a huge difference to us as researchers and academics, because you cannot be in a bad mood after going and meeting a blood biker. I can tell you, it's just, they turn up with this milk from mothers who they've collected it from in all different circumstances, and we put it in the freezer, and it just
amazing.
You can just see what a difference you're making to that community and that mother who you've collected the milk from, but also knowing that it's going to go and protect a tiny little baby.
Definitely.
So, I don't know how I get to call it work, to be honest. It's like, yes, but
that's the best feeling in the world. It's value that is bringing. Like you said, it's one of the best feelings, and a lot of people commented on this new electric vehicle as well. I've seen on social media, which is really exciting. So that was brought forward via the RWIF funding, wasn't it? So that was made possible through RWIF. Can you tell us more about that?
Yes, so we were lucky enough to be able to raise the money to purchase that vehicle through the Human Milk Foundation to be able to carry out the work in Wales. And it was partly funded through the RWIF funding and partly funded through a charitable organisation. It's just made such a difference, and it's so lovely to drive, because we'll put a photo at the within this to show you it. But it's an electric vehicle, so it's great from an environmental and a transport perspective. But just to drive it around Swansea, you stop at the traffic lights and people are like, what? What is that? And I like parking it. We keep it on the campus at the university, and I park it in different places because it amuses people so much to see. Because as you can see, it's really brightly coloured, and it's got urgent donor milk on the back of it, which has also been translated into Welsh, which to me, when I read it with the Welsh translation, always says to me, donor milk in a rush. So yeah, I just love it. And it's got, it's beautiful. It's also got if you look at it really closely, it's got the snowdrop emblem on it.
Wow.
And what that represents is the mums who donate their milk after losing their baby. So their baby passes away, but they find a lot of comfort in being still able to donate their milk to go to another baby. And they are all our donors are amazing, but they are such a wonderful group of donors. So they're represented. The charity has a really special scheme to support them, known as the Snowdrop Donors. So that's where the snowdrop emblem comes from, a sign of hope and a
And
we've got that on the car if you can see it. And we use it to collect larger volumes of milk. So there's only so much milk you can fit on the back of a motorbike. So if a mother has expressed lots and lots of milk, or she's got lots for us, we can go out and get that in the car, and that's always lovely.
Brilliant. And you've done so much research surrounding the process, and experiences of milk donation, haven't you, as part of your research? And why is that so important to, ensure that that's involved as well?
So we really wanted to tell the stories of the families who receive the milk and the families who donate the milk. So there is a lot of research around the impact of donor milk from a health perspective. And, in ensuring babies' health and development and survival. But there is less around the psychological experience of receiving the milk or being a milk donor. And given my backgrounds in psychology, I've always just been fascinated about how this all fits in. So we've been conducting research alongside that. So Dr. Natalie Schenker, who is one of the co-founders of the Human Milk Foundation and is also a UKRI fellow at Imperial, we've been conducting lots of research around the donors and the recipients' experiences. So one of the studies we did at the start was looking at how parents felt that being able to access donor milk for their baby impacted upon their well-being. And it just showed the huge value for them of having that option available and knowing that their feeding choices would be respected and listened to. And also just that feeling of other mothers out there expressing and donating their milk for their baby to have, that it felt like such a gift, and being so supported by that community around you. And we found that quite a few of the mothers in that study, if they'd received donor milk because they were building their own supply because of their premature baby, they quite often went on to be donors themselves and kind of fed back into that circle. So alongside that, the Human Milk Foundation, so they have donor milk for, they supply donor milk to hospitals, but they also have a community milk scheme that goes alongside it, where they have small volumes of milk for parents who, for whatever reason, are unable, their baby's unable to be breastfed. So they work with mothers who perhaps have cancer, who have had cancer in the past and had a double mastectomy, who have other health issues, who have been unable to breastfeed or are struggling with their milk supply at the moment, but their baby is really unwell but is older. So they're able to support them with some donor milk for their baby, but outside of the neonatal care system. And it's a really, novel and, special project that really shows the value of what we could do if we had more donor milk available to support more families. And we've been researching the impact upon those parents, so mothers, fathers, partners who, whose baby has received milk. And we're just really showing the impact upon their well-being. We've been measuring their symptoms of anxiety and depression and, well-being around it. And it's just really showing the protective impact of all of just being able to access the milk in that really, really difficult situation and feel supported. And then based on all of that, we've also been looking at the impact of being able to be a donor upon well-being. Just really showing the value of being able to donate your milk and why people donate their milk. And there are so many different reasons. Yes, it's benevolence. You have more milk than you need, so you want to help other babies, but actually it's far more complex than that. We've got so many mums who, really struggled feeding their baby and really wanted to be able to help another mum. We've got mums whose babies were in neonatal care and received donor milk themselves, and they really wanted to be able to give it back. And we've got some mothers who were bereaved again in that research as well. And it just shows the value of a system or a service. It's not just about a service where we've made donor milk more easily accessible for hospitals. Yes, on a service delivery perspective, that's what we've done. It's great. It's great from an environmental perspective. It cuts down on transport of milk. It makes it easier, but actually goes back to what I was saying about, it's about those communities. It's about that well-being. It's about supporting mental health and enabling people to be part of something. Just that value of being able to give something back, especially if you've received it in the past. And again, that's just, I'm so lucky to be able to do that type of research and work with those families and hear their stories.
And this wider research, you've been able to have a big focus on public engagement and making this work accessible. And, what have you done, or what do you feel like you've really done to help get this information on the Milk Bank Hub out to the public? How has that been? Has that been easy to do? Has it been easy to engage with the public, or has there been barriers?
I wouldn't say there are barriers. I'd say, it's always takes time. It always takes effort, but it's just really worth doing. So we've written a lot of blogs and a lot of articles. We've done a lot of social media. We've also had such interest from different news outlets as well. So there are a few clips of ITV and other news companies, doing little features on the milk bank and how we're doing. And it just gets so much positive attention. You just can't be sad at this story. We did one on the car the other day, and we can put a link into this, but I was just thinking, this is not a typical day in academia. I was working with the film company, and they're like, well, can you just get in the car and can you drive around the block and we'll film you coming round? I'm thinking, yes, okay. I could be a TV star for the day, but it's that. It's just so different, and it just shows, the value of engaging with the public and saying yes to things and doing things you're a bit scared of, and
And it's just so wonderful for people to hear about the research that the Research Wales Innovation Fund is helping contribute to, and about the amount of lives, and of course tiny lives in this project circumstance, that the funding's helping to improve. But it doesn't end there, does it? There's lots more plans for the future. Do you want to delve into some of those plans with us?
Oh, yeah, so it is the project that never stops. So every time we think, okay, we've done something, something else will happen, and we'll have opportunity to expand it, or another TV program or something else. So as you say, that it was a relatively, in research terms, small amount of money that we invested into this. And it's just, we've just got this established service now that just wasn't there 18 months ago. And I'm thinking, you think back, you think, well, how did we do that? It's just really changed. And again, it just shows the value of a bit of investment and what a relatively small amount of money can do to make a really big change, and that it just keeps on going. So we've got the car. We're hoping to expand our milk hub premises. Our ultimate aim, and we've been in discussions with Public Health Wales and Welsh Government about the possibility of, well, what could we do in terms of expanding this across Wales? So how can we support more families? How can we support more hospitals? How can we work with the other regional milk banks? So how can we work with Chester Milk Bank to have a strategy for Wales delivery of donor milk? How can we work together? How can we expand it further? So I would just say watch this space, that we just really want to make sure that as many babies in Wales can get donor milk as possible, and as many mothers in Wales can donate, and as many families can benefit from that whole experience, because we also have dads and partners in our research, and it just goes to show how much they value it as well. And we quite often speak to grandmothers who talk about the whole experience for their family. And when you go out and about in the community, you speak to people in the community who've seen the car and said, well, what's going on here then? And you suddenly find yourself giving a whole speech about donor milk and what it is. Somebody who, is actually just trying to do some building work, but stopped you and asked you what you're doing. And you're like, wow, let me tell you all about donor milk. But it's,
That's brilliant. I mean, I think it's such a brilliant example of how RWIF projects don't just impact the people directly, but it's impacting everyone, everyone that you could possibly think of who are related to it. It's just brilliant to know that so many people are being impacted by this RWIF funded project.
To show how long it lasts for as well, because the funding's ending. Gosh, the project isn't. The project would, it wouldn't end even if I tried at this point. It's a life of its own from that investment at the beginning. It was essentially money to support the development of a hub space and freezers, and then transport, because we started doing more. But it's the project that will carry on for a very long time, we hope.
Amazing. And if anyone does want to find out more about your research project, you can look at swansea.asot.uk/research. There's loads of information about that. And also you've got your own website, which is brilliant. You can find so many different examples and more information, really go into depth about your research, which is great. And you've also got a contact, don't you? Is it info@heartsmilkbank.org? And if anyone wants to find out more, get involved, I mean, feel free to contact Amy and her team, because the more people involved with this project, the better, the more people we reach as well. So, and also following your social media as well, because since I've started following now, I'm hooked. I'm absolutely hooked. So yeah, thank you so much everyone for listening. And thank you, Amy, for discussing your project today. It's been great to discuss it with you.
Thank you for having me.